Right, so I think we'll start. I'm Rose Forster. I'm a sexual health physician at Auckland Sexual Health Service. And since mid-August, I've also been the clinical advisor for sexually transmitted and bloodborne infections, which is a national role for Te Whatu Ora, or Health New Zealand. And it's in that role that I'm giving this update on implementation of the HIV Action Plan. So Sue McAllister mentioned the action plan in her talk earlier, but essentially the National HIV Action Plan 2023 to 2030 was published last year with the vision of an Aotearoa New Zealand where HIV transmission is eliminated and all people living with HIV experience long and healthy lives free from stigma and discrimination. So we've got 5 clear goals across the top that Sue also touched upon, which align with that vision and are informed mainly by the UN AIDS Global AIDS Strategy, but also other things. At the bottom, in the colours, we have focus areas for activities. So we have, in the green, surveillance, information and knowledge systems. In the blue, prevention and health promotion. Purple, testing and linkage to care. And orange, support for people living with HIV, including addressing stigma and discrimination. For each of those focus areas has various actions attached, and some of these actions have been prioritised for implementation between 2022 and 2026, and those are all on the bottom of the screen. And I'm going to go through those individually during this talk to talk about where we're at with those. So starting with surveillance, information and knowledge systems. So first of all, developing a monitoring plan for the HIV Action Plan. So the HIV monitoring plan was published in June of 2024, and that outlines the indicators that are going to be used to monitor progress towards achieving the goals and targets of the HIV Action Plan. So the HIV Monitoring Plan Working Group included members from Health New Zealand, Te Whatu and Ministry of Health, and also people with lived experience of HIV, who developed the initial HIV Monitoring Plan draft indicators. Those then went to the Sexually Transmitted and Bloodborne Infections, or STBBI, Technical Advisory Group, and each of those was assessed for priority and feasibility. And then the priority indicators were then included in the final HIV monitoring plan. So we are hoping to publish the first monitoring plan report by mid-2025. So next is monitoring HIV testing rates. So one of the things where there's a gap at the moment is really knowing enough about HIV testing and patterns and who is being tested, what the coverage is, where the gaps are and so on. So this is clearly really important. So work is being done so that we can actually monitor what's happening with HIV testing. That's involved doing a privacy impact assessment to enable data sharing between ESR, Health New Zealand, Ministry of Health. And that's taken longer than anticipated, but it's in its kind of final stages of sign-off at the moment. So once that's happened, this work is going to enable us to see, what the coverage is, where the gaps are, making sure that priority groups are being tested and informing testing strategies and approaches going forward. Increase Māori data sovereignty in HIV-related surveillance. So this work is being led by Hauora Māori Services and Health New Zealand, who were formerly Te Whatu. Because of significant changes within Health New Zealand, work related to this was put on hold for some time this year. But going ahead, work is going to involve pinpointing and discovering the key areas that need more focus within the HIV space, and developing a plan for areas where we can actively make a positive change in regard to Māori data sovereignty. Scope the development of an HIV patient registry. So one of the priority actions was kind of scoping and initial development of a surveillance system that could also provide a registry function. But following further consideration and noting kind of unclear benefits of this action, the public health agencies decided that it's not a current priority and this isn't being progressed further at present. Conduct seroprevalence surveillance to identify the prevalence of HIV. And again, this is really important. ESR were commissioned to look into the options available to identify the prevalence of HIV in New Zealand. And consultation also took place with the STBBI Technical Advisory Group. And then following further investigation, consideration of the findings from ESR and the feedback from the STBBI steering group, agreement was reached that the following actions are going to be progressed by the Public Health Agency. So modelling HIV prevalence in New Zealand, so that's going to help us better understand the burden of HIV and where further resources should be directed in order to prevent transmission. And also analysis of migrant health data as well. So a significant proportion of new diagnoses are being acquired outside of New Zealand, and this is going to involve work with Immigration New Zealand. And we'll also look at, the supports that are provided for migrants, and it will help shape and position services to where they're needed. Conduct behavioural surveillance among gay, bisexual and other men who have sex with men. So this is work that's led by Peter Saxton in association with Burnett Foundation and team. So HIV behavioural surveillance has been conducted in New Zealand every 2 to 3 years between 2002 and 2014. That was the GOS and GAP surveys. And then we had a gap, and then the SPOT study was done in 2022. So there's been funding for 2 further surveillance rounds of the SPOT study, so in 2025 and in 2027, repeating the online surveys, and also in 2027, repeating the in-person sampling as well. So that's going to be, really vital to providing data about behaviours of populations at risk. It's going to show us trends over time, and it's also going to be really useful for identifying health inequities as well. An audit of antenatal screening. The Public Health Agency is preparing an audit of antenatal screening to identify gaps in screening for HIV and syphilis, as well as general screening uptake and engagement with antenatal care. I mentioned the privacy impact assessment earlier, so that's a legal process that has to be completed to identify and manage potential privacy risks before the national testing data can be shared with the relevant agencies. And as I said, that's taken a lot longer than anticipated, but we are near the end of the process with the sign-off now expected in the very near future. And we're hoping that the findings of the audit will be released in the first part of next year. So moving on to prevention and health promotion. So promoting clinical guidance for PrEP and PEP. The New Zealand Sexual Health Society published updated clinical guidance for PrEP and PEP last year. And the Burnett Foundation, in conjunction with the Sexual Health Society, organised a PrEP and PEP tour of New Zealand. And that involved 282 primary care providers across 22 locations attending to get more information about prescribing PrEP and PEP and just increasing understanding about HIV. And there's also been various other promotion as well through health pathways and so on of these guidelines. So another key focus has been increasing knowledge and access to combination prevention for communities that have migrated from high HIV prevalence countries. And initiatives for that have included new engagement with African communities in the main centres, enabling family groups to receive relevant information about support, treatment and prevention of HIV. That, I think, has been mainly led by Positive Women. And training for refugee migrant communities in point-of-care testing alongside wider information around sexual health and prevention services. And again, Positive Women have largely been directing this. then the Sex Workers Collective has also been involved with arranging translated resources for sex workers from non-English speaking high HIV prevalence countries, and to ensure that they're aware of the risks of STI and HIV and know what to do if they've been exposed. The Haora Māori Services Group are leading work to support Māori organisations to deliver community-led social marketing to Māori to increase uptake of HIV combination prevention. And I think we've heard from previous talks, for example, Brooks, that this is something that is really needed. I gather this is also going to take a wider STBBI approach to also, increase knowledge about other STIs, particularly syphilis, which I think is going to be really important. So internal focus groups have been meeting to compile knowledge that's already been held to kind of potentially narrow down the focus areas for the campaign. That's going to be combined with outcomes of future external focus groups, and that's where things are at currently. The campaign's going to be developed by June next year. And the timing of the delivery of the campaign is going to be aligned with an HIV stigma and discrimination campaign that I'll talk about in a moment that's also currently in development. So testing and linkage to care. So ESR recently completed a review of evidence into innovative HIV testing and, unsurprisingly, concluded that community-based peer-led testing by NGOs is well established and works really well in New Zealand. And since the action plan's been published, work's been focused on commissioning community-based providers to deliver and scale up innovative approaches to expand HIV, syphilis and other STI testing capabilities, and also to provide workforce training to conduct testing as well. So, for example, to encourage testing in people who are not in areas where this isn't currently happening, but it fits well with the work they're doing and the populations that they're seeing. Innovative testing is being delivered in a range of venues, such as outreach services, testing at sex on-site venues, university settings, and a wide range of digital platforms, or a range of digital platforms. Social marketing approaches and campaigns have been used. So, for example, using the Grindr app to distribute HIV and STI self-tests to people at risk, and a new campaign, Don't Ride Distracted, that's seen doubling of usual volumes accessing HIV and STI self-tests. There are also vending machines to target testing gaps in high traffic sites for MSM and other priority populations. And there continues to be a strong focus on connecting with Haora Māori partners, refugee, migrants and asylum seeker groups, needle exchange services and sex workers to support communities to be able to deliver future HIV testing. So based on reports, around 4,000 tests have been delivered by community-based providers in the first 6 months of this year, and the scaled-up innovative testing is resulting in more Māori, Pacific and Asian people in particular getting tested. Almost 50% of those tested hadn't been tested in the previous 12 months, so that's great that we're kind of accessing those populations. And then work ahead over the next year involves commissioning expanded innovative testing for HIV, syphilis and other STIs. So I think this is really exciting to see where this work is going to go. HIV clinical leadership. So one of the initial priority actions was looking at the establishment of HIV clinical leadership roles to improve HIV responsiveness and increase access to testing. So the team, the STBBI programs team, has been asked to develop a revised approach for that that could better support a more sustainable sexual health workforce and help to increase access and maintain a focus on equity. And I actually think that the delay in this is a positive thing, because I think that we could do better than what the initial plan was, and I think this can really make a difference for sexual health services. Increasing contact tracing capacity and capability. So Health New Zealand are looking at establishing more frontline contact tracer roles in sexual health services. So this isn't just for HIV, this is for other STIs, but particularly syphilis as well. And I think, again, once this goes through, this will make a real difference to sexual health services. So work on this is continuing, it's still in the pipeline, but the current reset of Health New Zealand has impacted and is impacting on the team's ability to progress the work as quickly as planned. Support for people living with HIV, including addressing stigma and discrimination. So Burnett Foundation, Body Positive, Positive Women and Whatu Te Ao were contracted to scale up peer and community-led programs and resources that focus on connecting and empowering people living with HIV. So work has included scaling up current services to better meet the needs of people living with HIV, the delivery of peer and community-led public education programs, and kaupapa Māori options for Māori wanting culturally relevant peer-led support. I just briefly earlier touched on the social marketing campaign to challenge stigma and discrimination. So this is something that's currently underway and is led by the National Public Health Services Promotions in Health New Zealand. A People Living with HIV working group was brought together to co-lead the anti-stigma project and participate in the co-design process and to lead community engagement. So that sort of started around February or March of this year. A social change creative agency called Curative has been involved. They facilitated several online hui and a couple of in-person meetings as well with the working group to kind of co-design and workshop the building blocks of the campaign, so looking at root causes of stigma, the vision, who the audience is, and so on. The working group has led community engagement to kind of test concepts, to gather insights on HIV stigma from the wider communities and networks. And those insights from the working group and the community engagement has been compiled to and analysed to kind of inform the final strategy. So that's where things are at the moment, and over the next several months, that's going to be further developed and then launched, and I think this is going to be really exciting. So challenges and future priorities. There are challenges facing the sector at the moment that I think everyone knows about. There is progress in some areas, but there have been several challenges. So we have increasing transmission of STIs and ethnic disparities in New Zealand. We've got workforce shortages, such as a lack of sexual health physicians, and we have a need for increased access to testing and prevention services. So the current reset of Health New Zealand is impacting on the ability to deliver the HIV Action Plan initiatives as quickly as planned. But work is underway on the following initiatives to kind of help address some of those challenges. And these are the priorities for this coming year. And these are all the sort of things I've touched on in this talk as well. And I think these things, they're very exciting things that are going to be happening, and I think once they're in place, they've really got the potential to make a significant difference as well. So a couple of other things that I've kind of been looking into, and it's not so much related to the HIV Action Plan, but I think they're kind of relevant to mention here as well. I think it's really important that we raise awareness of HIV clinical indicator conditions, and those were mentioned a little bit earlier as well. I'm also on the chapter committee for the Australasian chapter for sexual health medicine, and this is also part of the sort of work plan, so it kind of fits nicely across all different roles. So an HIV indicator condition, for those who don't know, is a health condition associated with undiagnosed HIV infection. So if that's present, it's an indication for testing for HIV. You don't need to kind of ask questions about sexual history and so on. It's recommended that a test is done. So what I've been looking at is exploring the inclusion of a comment recommending HIV testing in the comments section on relevant lab results. So I've had a meeting with the New Zealand branch of the College of Pathologists about this. And I've also met with Health Pathways about including HIV testing for HIV indicator conditions in the relevant pathways. So none of this is going to happen quickly. It's something, that slowly over time can be added. But anyway, the work is in progress. The other thing that I've been looking at is related to antiretroviral prescribing and dispensing. So at the moment, we can do prescriptions for a maximum of 3 months. And so tenofovir tricytidine, or PrEP, can be dispensed the 3 months in one go, but other antiretrovirals, for example, dolutegravir, at the moment can only be dispensed monthly, which obviously is a barrier to access and to adherence as well. So I have spoken with Pharmac, and I gather they've already been looking into this and are planning on putting out a public consultation kind of soonish. There's no definite timeline for that yet, but that will look at STAT or 3 monthly dispensing for all HIV medicines, rationalising or removing the special authority for PrEP, for example, and a couple of other things. So at some point soon, the sector should hear more about that. I gather there's also been some work being done, not by Pharmac, by someone else, looking into the possibility of longer prescribing for certain groups of medications. And so I have asked for antiretrovirals to be considered in the work that they're doing for that as well. And again, don't know how long that's going to take, whether it will happen when, but anyway, that's something that the conversations have been started anyway. So I think that's the end of my talk. Have we got time for questions, or are we... Yeah? Any questions? Oh, Jeannie.
Kia ora, Rose, that's brilliant. I just wondered if on the plan is universal testing in healthcare settings.
So I would actually, and this is really something I really want to do, I think we need to just normalise HIV testing full stop and remove the exceptionalism, that it should be the same as any other test, basically, that we're doing in a hospital setting. And I actually think the fact that it's not is actually harmful to people. So that's something I really want to try and progress, and I think if we put that on the agenda for the next HIV forum, I think it may be anyway, and so yeah, I agree. I just think the fact that there's something different about doing an HIV test means we're not doing as much testing, and it's actually harmful to people, and I think we need to change that. So that is one of my priorities. Yeah. Oh, Nigel.
Yeah, clinicians are kind of interested in making sure that there's that the clinical services keeping people engaged in care have enough people to carry on doing that. And I think the arguments for that are particularly that that often mobile populations, and there's quite a lot of work goes, especially by the nurses, into keep tracking people and working out if they've moved, why they're not, if they're taking their meds, and if they're falling off the wagon, why, and how they can be re-engaged, especially if you're trying to get down to those last few people. Numbers increasing, as we saw from Sue this morning. So that just seems to be slightly a missing element from the plan in some ways.
Yeah, potentially. And I am very open to hearing from people and having people's ideas. I would really like it if people get in touch. So please email me. And I can't, I don't know how much ability I will have to make stuff actually happen, but certainly I can try. And I think it's really important to have everyone's input so that we're working on the right stuff. And I agree with you. I think that's a gap at the moment.
Kia ora, Rose. Kia ora, hi. Over here.
Oh, sorry.
Hello. Thank you so much for your presentation. My question is, there's been a lot of talk today about community, and I couldn't help but notice in the presentation there isn't a lot of space in what I was seeing for people living with HIV to have community-led initiatives. There seems to be a lot of consultation with people living with HIV, but not much with people living with HIV leading. So how much space do you think in the next year there will be for this section of the implementation, and what might that look like going forward?
So these are the actions that have been prioritized and I guess funding set aside and stuff for the next couple of years. And I think, certainly with things like the monitoring plan indicators, for example, where the initial group that came up with the draft indicators, that involved specifically people living with HIV and the stigma campaigns and so on as well. I think it's incredibly important that the community does have a leadership role in things. I think the NGOs sort of do a lot of work involving, the NGOs often are, depending on which NGO, people living with HIV, and that's been really important in directing the work that we are doing. But as I said, I'm also really open to hearing ideas. So please, if people have ideas or things, please email me. I really want to hear from you. Yeah.
Kia ora. One thing I've noticed from doing HIV testing or sexual health testing myself is with international students, when they come here to New Zealand, they obviously have to have some sort of medical insurance, but quite often that medical insurance does not cover sexual health testing whatsoever. And obviously there's a massive gap in the market there just to help international students. So my question is, what can be done about that?
Yeah, I'm really aware that there is that gap. I think people at the moment, there are different situations in different areas of New Zealand about, testing through sexual health services and so on. So I think it's worth people knowing what the situation is in their area so that they can direct people to the most cost-effective or free options. But certainly I'm really aware that there is a gap, and it's something that, I have raised, and I think we do need to do some more work on that.
I have a question/comment. Just with the work that Hep C's been doing in leading in testing spaces and stuff like that, they've been doing an amazing job with their campaigns and getting testing out everywhere, and being the first one to go into emergency rooms and get bounced out of emergency rooms. I think there's really good opportunities to collaborate with them at an SDBBI level rather than a HIV, Hep C, syphilis kind of way, and can we do more of that?
Yes, I think that's really important to do that. I think in healthcare settings, there's a lot of really cool stuff happening, but it's often very sort of siloed, and people don't know what's happening elsewhere. So it is about kind of making sure that we're linking in with other services, particularly services that are providing services for sort of population, our key populations as well, and really trying to combine what we're doing rather than just making things separate. And just as an example with the Hep C, so I gather in Te Manawataki, is Amanda here, I think, somewhere, HIV nurse from Hamilton. Oh, yeah, sorry. And I think you have gone out, haven't you, with the Hep C team in Te Manawataki, and have gone out and done the HIV testing. So that's an example of where that's kind of been combined. And I think there's a lot of opportunity to do more of that as well. Yeah.
Thank you.
Thanks.